Hello, and thank you for joining us. The following is an interview with Lana Makhanik and Peter Fiorentino discussing the benefits achieved and lessons learned after Beth Israel Deaconess Medical Center implemented UHF RFID technology to optimize their inventory management system. We hope you enjoy.
So Peter, tell me more about the hospital you work in and your role there.
Yeah, I work for Beth Israel Deaconess Medical Center. We're a academic medical center affiliated with the Harvard Medical School, and I am the material manager for the cardiology department.
And so I know Beth Israel recently implemented the inventory management solution across multiple departments in the cath lab, EP lab, GI, and endovascular ORs. Tell me what prompted that initiative for the organization?
Well, what we wanted to do was standardize the process between departments in tracking material real time. Mm-hmm. We wanted to optimize our inventory management. Mm-hmm. We wanted to eliminate expiring stock. Mm-hmm. We wanted to downsize a lot of the overstock that we would have, lower costs, and increase revenue. Yeah. All of those add to that.
Absolutely.
And most of all, we wanted to make sure that we were up to time with the FDA UDI requirement mandating that all medical devices require the UDI.
Yep, that makes sense. That's important. I know you have chosen ultra-high frequency RFID technology to fulfill those objectives. What prompted you to look at UHF RFID as your solution?
Well, there are many reasons. I'll touch on a few. First of all, UHF RFID is globally standard compliant. Mm-hmm. It can read and process any GS1 UPC global RFID label. Mm-hmm. And it's readable by all UHF standard compliant devices or handheld devices. Second, it supports FDA UDI mandate requirement. The UDI data, namely manufacturer's name, batch number, lot number, serial number, expiration date, is all encoded onto the RFID tag and is readable by any UHF device or reader. Third, there is no bulky, expensive cabinets needed. The RFID technology that we chose is VUETrack RF by VUEMED, and it requires antennas that are hand-free. Fourth, UHF RFID technology and continuously tracks material throughout the process from start to finish. Manufacturers and hospitals are able to trace the product from start to finish. The manufacturer is able to track this product right from the supply chain all the way to the point of use or the point of care.
What about making sure the data gets into other systems?
Oh, sure. With UDI data, clinical data can be tracked all the way to billing, ERP system, health records, and finally, UHF technology is economical and easy for manufacturers to adapt. Leading manufacturers such as Medtronic, Boston Scientific, Terumo, Johnson & Johnson, Abbott are already labeling product and sending it into our facility prior to us receiving it. So as soon as it shows up in our inventory, we know it's there.
Right, which is terrific.
Yeah.
So what are some of the actual benefits you have received from implementing the system that you can tell us about?
Well, we're able to track product from the point of reception all the way through where it's being used. We're being able to eliminate overstock, over-purchasing supplies. We're able to track the destination of the product, how it moves from different locations, from our stock room to a control room to a procedure room, we were able to track and say, well, how long is it taking our clinical nurses, technicians to go all the way to the stock room, almost like a value stream initiative, to say how long is it taking them to go get product.
Right.
And we were able to look at the data and move the product closer, like a CTO case. We were able to move that whole cart into the room to keep the clinician closer to the procedure room and closer to the patient. You know, saving time and money for them moving back and forth.
Absolutely, and that's terrific.
Yeah, and patient care as well.
Absolutely. What about things like expiration management and charge capture issues, which we know a lot of hospitals struggle with?
Sure, yeah. One of the things that was really great for our patients is that we were able to look at and see what's expiring beforehand, what's been recalled beforehand. Those are key patient care initiatives that we were able to implement that, you know, before we didn't know whether we had to I used to have to go around and check to see if what was expired. Now with VUEMED, I'm able to look at a month out, 3 months out, 6 months out, see what's expiring. It helps me also to return supplies to suppliers that you know, most suppliers want 3 months notification of stuff that is expiring, and they'll return it for you.
That's right.
You know,
instead of you eating those costs.
Instead of we'd be eating the costs.
That's right. What about charge capture benefits? Can you talk about those?
Yes. Yeah. Very helpful. What we used to do is, again, a lot of our processes were manual. We would scan product in, but some product could be missed. We wouldn't capture the total charge of what the case was. With VUEMED, the product moves into the case, is scanned into the case. We are lot numbers. Everything is captured for that case. If it's not used, it's taken out of the case and returned to my inventory. We're able to document our charges and charge for our cases much more accurately than we used to be able to do.
Lessons learned from implementing a system like this that you would share with your colleagues at other facilities?
First, it's very important to have an inventory management process in place, and to first have the personnel in place. If you don't have the process in place and the personnel that want to work with that process, you could have issues with it. So you want to have dedicated personnel ready to work on the implementation.
Absolutely.
You can't have people and there's a STEMI running out of the case, running out of training, you know, to go take care of a STEMI. You need to have processes in place and backup in place in your hospital to make sure that they work with everybody there so that the training can take place, processes can be tweaked, and everybody agrees with the process. Yeah.
And then I know you and I talked about some of the, obviously, data analytics benefits.
Yeah.
You speak a little bit more about that, how important it is to have.
Yeah, second, it's very important to have a data analyst that will take a look at all the data that the system will provide. It's important to analyze that data that the system is giving you so that if you see your inventory price has gone up, people will say, why is your inventory price up? Well, our case numbers are up and our cost per case is down.
That's right. Important to put it in the context.
You need to put it in context and take a look at somebody analyze the process, analyze the data that the system is giving you. And
then we talked about the fact that we want to make sure the manufacturers continue to support you.
Yes, it's key. It's very key that our partners, suppliers, you know, that they continue to label the product for us. It's very important that the product shows up to us already labeled. It's important that they're involved in the software that VUEMED it has for them, that they can track their product as well through the supply chain. And you know, one of the things I see is that there's less having to have suppliers come into my facility to count consigned material. They're able to look at it on their database, on their software, and say, here's what we have at Beth Israel. Here's what it's being used on. And they can use the data as well. So it's very important that they continue to label and use the software that's available.
That's right, and use the data available, of course, to track their own inventory.
Exactly.
Absolutely. And then I know we talked about obviously the benefits of UDI. The UDI data is being captured.
Yep. It's very important that the data that is captured is analyzed and that
it works with your material management system.
Yes, works. That you implement that the data that you get out of VUEMED and the software system, that you implement that into, which ours is PeopleSoft, but you implement that into your material management inventory system to get the full benefit out of it. I'm able to now reorder, looking at, instead of a day that would take me, I'd look at it the next day and say what was used on the day before. By the time the product came in, it was 2 days. I'm now able to look at material requirements, the end of the day that was used, approve the requisition. It will go through our PeopleSoft system, and the purchase order is placed. I'll get it usually the next day. So I'm saving a day to 2 days on most of the material, especially emergency equipment that we need immediately. So we save 24 hours on that.
No, that's fantastic. And I know you've been working a lot on optimizing things like par levels as well through the consumption data.
Yes. And that's part of the thing that I see that is very, very, very beneficial to us is being able to set all the par levels where like I said, suppliers used to come in on their consignment level, whether it was implementation, whether it was defibrillation or pacemakers. A lot of that's on consignment.
Right.
They're able to see what their consignment levels are on our site. I'm able to see what it is, as well as all of the other inventory where even stents and balloons that were on consignment that suppliers would come in once a week, twice, every other week, take inventory. I don't need to see them as much anymore. Not that I don't mind seeing them. They do have a lot of benefits. But with the VUEMED system, I'm able to take a look at what our par levels are and adjust it based on our usage. And the system will notify me that day that I've dropped below par level. And then I need to reorder.
Correct. Or get additional items if it's consigned inventory, correct? Without them having to come in.
Exactly.
Yeah, that makes a lot of sense.
Yeah.
Well, thank you so much for your thoughts and insights, Peter.
Thank you, Lana. My pleasure.